females are definitely much more likely to end up with POTS. That's nearly 80% are going to be females. Okay. So it's females way more. I've seen it in teenagers and I've seen it in adults. It kind of hits the full spectrum. So no one's necessarily immune from it. We're going to say cardiovascular POTS. So that's hypovolemic. We're going to say immune system POTS, mast cell, and then we've got autoimmunity. Okay. So we're going to lump those two together for the purpose of this. And then we're going to have norepinephrine based POTS issues. Okay. Not as common in my experience. And I see mostly the neurological and the immune system mediated POTS. So that's the lens we're going to take with this. Now, you may be wondering, who am I? Well, I'm Dr. Spencer Zimmerman. I'm licensed as both a doctor of chiropractic with a diplomate in chiropractic neurology, as well as a family nurse practitioner. And I've been helping people with brain-based issues for over a decade now. And I've learned a lot along the way, and I'm sharing this with you because I do see a lot of patients who are struggling with POTS, and they've done everything that they've been told up front, right? There's primary POTS, there's secondary POTS, which we've already said, mast cell related issues, diabetes, infections can cause it. So there's been a lot of issues with COVID where those individuals end up with POTS. We have associated things. So these are people who are set up for POTS. So Ehlers-Danlos syndrome, chronic fatigue syndrome, brain injuries, okay, concussions, TBIs, as well as migraines. Now, when we look at Ehlers-Danlos syndrome, basically, if you're not familiar with what that is, these people, they tend to have a lot of gut issues. They also have hyperflexibility. So they'll do things with their joints, like their elbows, their fingers. It's like, that's not really normal. They're prone to dislocation. They can be prone to spraining an ankle, hyperextending something. Okay. So that's what that looks like. Now, it's important to remember that there are things that can be associated and you do not have to be one. And that's one of the big things that I see is people, they get kind of put into this little box and they're like, oh, well, that's the one I've got. And it's like, well, is it really the one you've got?